So hi everyone. Welcome to our seminar today on the topic of adjustment disorder. Thank you for signing up to our seminar with Dr. Abhishek Nagesh. Please note that the seminar is recorded and will be published on our YouTube channel. If you have any issues with this, please do let me know immediately. I would kindly ask for all the attendees to mute yourself during the presentation to show respect to the presenter. And if there are any questions, please pop them in the chat box or wait until the end for the Q&A session. So just a few words about Dr. Nagesh. So he provides assessment and treatment services for anxiety disorders, mood disorders, psychotic illness, personality disorders, both as an inpatient and outpatient basis. In addition, he also provides treatment of adult ADHD for those adults who have been previously diagnosed with ADHD during their childhood years. Dr. Nagesh has a rich working experience in psychiatry, both in the UK and Australia, and is a fellow of the Royal Australian and New Zealand College of Psychiatry. In addition to the private practice, Dr. Nagesh is also a staff specialist at Campbelltown Hospital and holds academic appointments as conjoint lecturer with the Faculty of Medicine at the University of Western Sydney. So now over to you, Dr. Nagesh.
Thanks, Sophia. Good afternoon, everyone. I'm Dr. Nagesh. I'm one of the psychiatrists who primarily works in Campbelltown. I work both in the public and private setting. I'm here to talk today about adjustment disorder. So adjustment disorder is not a complicated mental illness. It's quite a simple disorder. It's quite straightforward to diagnose. And probably it's one of the commonest disorders seen both in a clinical setting and a medico-legal setting. So let me start by explaining what is an adjustment disorder. How is it caused? Basically, in the DSM-5 diagnosis, it is classified under the stress and trauma-related disorder. What that means is when a person encounters a stressful situation or a traumatic situation, he can develop certain emotional and behavioral symptoms in response to that stressful or traumatic event. So that's what basically adjustment disorder is. By definition, the symptoms of adjustment disorder must develop within the first 3 months of the stressful event, and the symptoms must disappear once the stressful must disappear at least after 6 months after the stressful event has been disappeared. So what are the stressful events? Stressful events can be anything. It can be ranging from financial stress, marriage breakup, job loss, role transition. For example, when somebody retires, they can develop adjustment disorder. Even developing a new medical illness, medical problems can also give rise to adjustment disorder. In any kind of stress, including traumatic events, loss of a family members, can all give rise to an episode of adjustment disorder. Sometimes natural disaster, where not just one individual develops adjustment disorder, but the entire, the community can develop symptoms of adjustment disorder. In a medical legal setting, the stressful events can be different. Motor vehicle accidents, people can develop an episode of adjustment disorder. Bullying, harassment at workplace can give rise to adjustment disorder. If somebody has been assaulted, threatened, intimidated, that can give rise to adjustment disorder, or even verbal abuse. A lot of the times you do see claimants or patients developing depressive and anxiety symptoms secondary to a physical injury, which can also be diagnosed as an adjustment disorder. There's a myriad of stresses you can think of, which can all give rise to an episode of adjustment disorder. The stressful events which I have listed here are just limited. You could think of anything, and a person in response to a stressful event can develop some behavioral and psychological symptoms, which then can be diagnosed as an episode of adjustment disorder. So what are the common symptoms you see in somebody who suffers from adjustment disorder. They're grouped mainly into three types: mood symptoms, anxiety symptoms, and conduct symptoms. Mood symptoms, you don't see somebody manic. Usually you see, you say that the person is suffering from adjustment disorder with depressed mood, when they are predominantly presenting with depressive symptoms. Mainly the mood is depressed, they're crying a lot, they think of death or suicide, they feel hopeless, worthless. Or they can present with anxiety symptoms where they worry a lot, they find it hard to relax, they can be a little bit irritable, they can be having panic attacks. Or sometimes, rarely, you see people presenting with conduct symptoms, where they're quite aggressive, they have no regard for the law, they can be seen driving recklessly. Having said that, the symptoms are not just limited to the just above three classes. You can find any number of symptoms. Adjustment disorder is a broad diagnostic category. Sometimes you find patients presenting with mood swings, sometimes irritability, sometimes they can present with PTSD symptoms. They can have nightmares, flashbacks. They can withdraw socially. The self-care might decline. They can even present with physical symptoms like headache. They might be having nausea, or diarrhea, or they can start to resort to use drugs and alcohol. There can be cognitive difficulties as well, but you never see psychotic symptoms in somebody who is suffering from an episode of adjustment disorder. So, what are the risk factors, or who normally develops an episode of adjustment disorder? Look, anybody can develop an episode of adjustment disorder, because we all are exposed to stress in our day-to-day life. Each of us handles stress in a different way. Some of us have better coping strategies. We handle stress better. We don't go on to develop any symptoms. We continue to function. But there are individuals who are already prone to develop a mental illness. And who are these individuals? Most of these individuals are, they are people who've had a disruptive childhood. It could be anything. you know it could be ranging from a loss of parent as a child, coming from a dysfunctional family background where they were, physically, emotionally, or sexually abused as a child. Any traumatic event as a child makes them more vulnerable. And if they're already suffering from other mental disorders like major depression, bipolar, or a psychotic illness, or an anxiety disorder, or a personality disorder, in fact, are more prone to develop an episode of adjustment disorder. A lack of support system, they live alone, no family support, uh, can also, make them vulnerable to develop adjustment disorder. Sometimes chronic stresses, people who are under financial stress forever, they're also more vulnerable. Any kind of early childhood vulnerability can, to make a person develop an episode of adjustment disorder. People who've been assaulted in the past, who already have been diagnosed with some other mental illness like post-traumatic stress disorder, also are more vulnerable. People who use drugs, alcohol, are also more vulnerable. Having said that, you don't have to have a vulnerability to develop an episode of adjustment disorder. Any individual can develop at any point in their life when they're exposed to a stressful or a traumatic event. Um, yeah. Now, how do we diagnose adjustment disorder? Of course, one the essential criteria is the person should have been exposed to a stressful or a traumatic event, and in response to that stressful or a traumatic event, certain emotional or behavioral symptoms develop, which could range from anything to depressed mood, anxiety, conduct symptoms, sleep disturbance, appetite disturbance. It could be anything. The number of symptoms I mentioned, one could develop. And usually the symptoms develop within the first 3 months of the onset of the stressor, and the symptoms should be behaviorally and clinically significant, where the person is distressed, and there should be some level of impairment in socio-occupational functioning. I mean, a person could be exposed to stress, but they're not distressed, there's no significant impairment in functioning, they don't develop a myriad of symptoms. That's not adjustment disorder, it's just a normative stress reaction. They also should not meet the criteria for other mental disorder. Let's say, for example, somebody's symptoms are so severe that they meet the criteria for major depressive disorder, then you can't diagnose somebody with adjustment disorder. The symptoms should not represent normal grief or bereavement. I'll tell you later what is the difference between grief and bereavement and normal depression. Um, the criteria E is once the stressor or the consequence is terminated, the symptoms should not persist for more than 6 months. What that means is, let's say somebody lost their job 6 months ago, they do develop certain symptoms, but after 6 months, the symptoms should disappear. That's what adjustment disorder is. Um, Adjustment disorder can be of different types. When the mood symptoms predominate, we call it adjustment disorder with depressed mood. When it predominates, when the anxiety symptoms predominate, we call it adjustment disorder with anxiety. When both mood symptoms and anxiety symptoms predominate, you call it adjustment disorder with mixed anxious and depressed mood. When conduct symptoms predominate, you classify it as adjustment disorder with disturbance of conduct, or it could be a mixture of both emotions and conduct, which includes mood and anxiety symptoms. Then you just refer it as adjustment disorder with mixed disturbance of emotions and conduct. What are the risks associated with adjustment disorder? Rarely you can see a person having suicidal thoughts. So suicide is a risk factor when somebody is suffering from adjustment disorder. Aggression is also a possibility where a person is irritable. It can lead to aggression. Somebody experiencing conduct symptoms, you could see aggressive behavior from them, and reckless behavior can also be seen when somebody who is presenting with adjustment disorder with predominantly conduct symptoms. What are the common disorders which mimic adjustment disorder, and we consider them as differential diagnosis? Number one would be the major depressive disorder, where in major depressive disorder, a person also develops depressed mood and some anxiety. They have trouble sleeping. There's appetite, which can also you can see in adjustment disorder with depressed and anxious mood. So the key thing to remember is if the person meets the criteria for major depressive disorder in response to a stress, then we don't diagnose them with the adjustment disorder. So we diagnose them with major depressive disorder. The other different disorders which mimic adjustment disorder are acute stress disorder and post-traumatic stress disorder. In acute stress disorder, usually it doesn't develop in response to a stressor. It's usually after a traumatic event where the person is, exposed to death or threatened death. And you can, the, the symptoms usually in acute stress disorder developed after a 3-day period, but they're not meant to be lasting for more than 4 weeks. That's when you call it acute stress disorder. The normal symptoms you see in acute stress disorder are more trauma related symptoms. That's the key difference between acute stress disorder and adjustment disorder. Uh, if somebody doesn't develop trauma related symptoms like nightmares or flashbacks, then they just become depressed or anxious, then you could call it an adjustment disorder. um, Post-traumatic stress disorder develops in response to a traumatic event. It doesn't develop immediately but develops after a month of the traumatic event. And post-traumatic stress disorder has its own gamut of symptoms, and you could clearly differentiate it from adjustment disorder because you see avoidance, you see intrusion symptoms, you see arousal symptoms, which are not normally seen in adjustment disorder. um, Post-traumatic stress disorder, persists, can run quite a persistent and prolonged course, unlike adjustment disorder, which resolves within 6 months. So that's how you differentiate between PTSD, adjustment disorder, acute stress disorder, and major depressive disorder. Another disorder which closely resembles adjustment disorder is bereavement or bereavement. In bereavement, normally the effect is one of loss or emptiness. The person is preoccupied about the deceased person, and the person is not dysphoric all the time. When he is dysphoric, he's usually preoccupied and talking about the dead person. The talk is mostly surrounds around the memories of the deceased. And sometimes he's self-critical that I should have done this when he was alive. I did not do this. So that's the theme around bereavement, and that's how you differentiate it from adjustment disorder. Or sometimes the other differential diagnosis can be a normative stress reaction, where when something bad happens, we all react in a different way. Um, it could be just an emotional reaction. That's what you see in a normative stress reaction. You don't see the evidence of distress or the socio-occupational impairment which you see in an adjustment disorder. So that's how you differentiate between normative stress reaction and adjustment disorder. Then there are other stress-related disorders, which they're basically not a DSM-5 diagnosis, but there's something called as research criteria, where as I said, in adjustment disorder, the stressor is there and the person develops the symptoms within the 3-month period of the stressor, but sometimes there's a delayed onset which can occur after 3 months of the stressor, where you call it adjustment disorder with delayed onset of symptoms. Sometimes, usually adjustment disorder is meant to resolve within the 6 months after the onset of the stressor, but sometimes the duration can be prolonged. Then you say adjustment disorder with prolonged duration of more than 6 months. Then you have your persistent complex bereavement disorder characterized by persistent grief or mourning. These are some of the other stress-related disorders, which I thought I'll just mention, but I don't think they're of any significance. What is the cause of the illness of an adjustment disorder? Adjustment disorder usually doesn't have a chronic cause. It's usually acute. What that means is there's a stressor or a traumatic event. The person develops symptoms within the first 3 months, and the symptoms do not last usually more than a few months. Usually self-limiting. A lot of people don't need any treatment. The symptoms resolve by themselves. But by definition, once the stressor or its consequent is terminated, the symptom should disappear within 6 months. If it persists beyond 6 months, it usually goes on to become an anxiety disorder or a major depressive disorder. So adjustment disorder basically runs a very short course, self-limiting itself to a period of up to 6 months. What's the prevalence? How common is adjustment disorder? It ranges from 5 to 20%. It's commonly seen in clinical settings as well. There's a lot of stresses around us. People do present with depressive and anxiety symptoms to the emergency setting in your private clinical practice as well. Yeah, I think it's the most commonly diagnosed condition in medico-legal settings, and also in medical settings. When somebody develops a medical illness, they do go through a range of emotions where they usually meet the criteria for an episode of adjustment disorder. Prognosis generally good. It's a treatable condition. As I mentioned, a lot of the times people don't need treatment. The symptoms resolve by themselves. Sometimes they do require treatment, but majority of them return to previous level of functioning within the first 3 months, but some do take a bit longer. Some take up to 6 months. If the symptoms persist beyond 6 months, the symptoms are quite severe enough that they end up usually meeting the criteria for another mental disorder, like major depressive disorder. What's the treatment? As I mentioned earlier, some cases do not require any treatment. The symptoms are resolved by themselves. But if somebody does require treatment, the mainstay of treatment is psychological therapy, usually cognitive behavior therapy. Sometimes interpersonal therapy is useful for somebody who's had role transition or having interpersonal conflict. The common CBT strategies like problem solving, teaching them relaxation strategies are enough to treat an episode of adjustment disorder, but rarely you would require pharmacotherapy. Pharmacotherapy is usually for symptom management, where somebody might be having difficulty sleeping. They might need sleeping medication for a few days. Somebody might be experiencing severe anxiety symptoms. They might need some anxiolytic medication temporarily. Otherwise, pharmacotherapy is rarely used. And some, as I said, sometimes the symptoms are severe enough that they meet the criteria for major depressive disorder, and then they might require antidepressant medication. Comorbidity, a lot of the times you could diagnose adjustment disorder with another mental disorder. Somebody could be having personality disorder. At the same time, you could develop adjustment disorder. Somebody could be suffering from OCD. At the same time, they could be suffering from an episode of adjustment disorder. So yeah, a very short presentation. I hope I was not too quick. Any questions?
Yep, so thank you so much for that, Dr. Nagesh. If anyone has any question, please come forward and just unmute yourself. However, yeah, we have one question from Hen in the chat box, and it says that, "Hi, Doc, you mentioned the stressor that should be resolved after 6 months, but what if there is another stressor before the primary stressor is resolved? For instance, there is some family problems, and before I could come out of that trauma, I also faced a traumatic event at the workplace. After a few months of primary stressor occurred, just like back-to-back stressful events, and it's bothering."
Look, if you have another stressor, yes, I mean, you could still, because of the second stressor you have experienced, you could still experience another episode of adjustment disorder. It's quite common. I mean, psychiatry is not black and white, so it's not like, yeah, you've had a traumatic event or a stressful event in your life. Secondary to that, you've developed certain, emotional and behavioral symptoms, and within a few months time you've had something else affecting you. Your symptoms could become worse because of the second stressor. That doesn't mean that it doesn't strictly apply that by 6 months it should resolve. It doesn't ideally happen that way, but it's more for the definition purpose. I said 6 months.
Yep, thank you so much for the answer. Does anyone else have any question? Or if you do, please unmute yourself and yeah, just come forward. Because I
Hello.
do. Oh, sorry. Yeah. Sorry, please go on.
Hi, Doc. So I understand how you said, like, always there will be something happening in life. It's not like we're going to just come out of it. So I have been diagnosed with adjustment disorder, and I was told that you have to do some like meditations, cognitive therapy. No medications were required at that time. But now I feel it's affecting my health, like where I feel like heart palpitations, I get angry a lot. Is there anything that we can do that can help us?
Oh, look, I am just as I said, if it's you're if you're seeing a psychiatrist and a psychologist, they are the best person to advise you regarding your treatment. I mean, not knowing your history, it's hard for me to comment. I mean, there are a number of treatment modalities. I mean, as I said, a lot of the times when an adjustment disorder doesn't resolve by 6 months, it goes on, people go on to develop a major depressive disorder. There are a number of treatment modalities for an episode of major depressive disorder. There's so many treatments. There are a number of medications, augmentation strategies. There are a number of therapies there. There's TMS, there's ECT. I mean, it's a discussion best to have it with your treatment providers rather than, it's hard for me to comment here on what would you would benefit from, what type of treatment, not knowing your history.
Agree. I understand. It's just where I'm from in the US, the therapy itself is so expensive. And then they told me I can do some work at home. So, is there anything like, I know if I would explain you the history, it will take a lot of time for everybody else. But yeah, it's just like something that if a person cannot see the psychiatrist right away because of the cost, of course, is there anything that you would recommend to do at home?
As I said, adjustment disorder, if you're suffering from adjustment disorder, the symptoms are self-limiting after a few months. I mean, look, eating healthy, exercising, doing some, if you can do yoga, learning some relaxation exercises, trying to have a good sleep, things like that, that's useful as well.
Yep. So thank you so much for that, Han. We do have another question in the chat box from Katie. She said that you indicated that the majority of symptoms should resolve in 6 months. In the case of workers' compensation, why is it we see the stressor resolved, but the incapacity is often prolonged for several years? How can we strategy against this?
I mean, as I said, if the symptoms persist beyond 6 months, it's probable that they've gone on to develop another mental disorder like major depressive disorder. It's hard for me to comment in work. Yes, often we do see in workers' comp case, the stressor has resolved, but this person is still experiencing the symptoms, and in all probability they have gone on to develop a major depressive disorder of mild to moderate degree, and that's why the symptoms are prolonging, and I don't have a definite answer for that.
Yep. Thank you for that. And I think that's all the questions for now. Does anyone else have any question? If you do, just unmute yourself. We'll take one last question before we end the seminar. Okay. Sorry, I just have one last question for you, Dr. Nagesh. This is from a case manager that weren't able to attend this seminar, but so the question is, have you encountered patients who malinger about the disorder, and how did you find out if they were?
Look, it's hard to diagnose malingering in a cross-sectional examination. So it's very hard to say who is malingering, who is not malingering, unless you can't say confidently in a cross-sectional examination somebody is malingering. Of course, in a medical legal setting, you do consider malingering as your differential diagnosis. I mean, if one is malingering or not, that can be said for sure only in an inpatient setting where the person is closely observed 24/7. I can't say with confidence that I've encountered patients who are malingering. So sometimes, yes, you can speculate. It's possible that this person is malingering because the stressor was quite trivial or whatever. But it's hard to say with confidence, yes, this person is malingering.
Yep, no, all good. Thank you for your response, Dr. Nagesh. So yeah, I guess that is all for the seminar today. So this recording will be published on our YouTube channel, and we will send through the seminar slides after the recording is published to the attendees as well. So thank you so much, Dr. Nagesh, for doing this with us.
Thank you. Thanks.
Thank you.
Bye-bye.